This is Jen and Ikina on Eyesurgeontalks, and I wanted to do a little video on diabetes. Now, I've got a previous longer video on diabetes, but it's just a topic so close to my heart because I see so many patients in clinic, so many eye problems from diabetes, and the problem is you don't know that the problem is happening. Diabetes is such a sort of a horrible silent disease. You don't know you have a problem until suddenly everything sort of starts to fall off a cliff. I see lots of young patients who maybe have had type 1 diabetes for a while, not had any issues, and then they lose sight. And unfortunately, with diabetes, we're often playing catch up with the eyes, and we're firefighting, and essentially going back in time and controlling the diabetes over a longer term is the best way to prevent problems. What problems can you get? Well, the most common cause for loss of vision in diabetes is bleeding inside the eye. And that happens because of the development of abnormal blood vessels, because of a lack of good blood supply in the retina due to diabetic damage. And there's a whole ladder of treatment that we use. We may need to use injections inside the eye of drugs that shrink abnormal blood vessels. We may need to do laser to the retina to sort of remove areas of the retina that are unhealthy. And we may need to do surgery, which is really, really big, retinal surgery. If you have diabetes, please look after yourself. Please look after your sugars. Please look after your blood pressure. Prevention is better than cure. And good control of your sugars and your blood pressure is the absolute best way to ensure that your eyes stay healthy. If you do need to come to screening, please attend the screening. These appointments are usually annual or twice yearly. If you need to come to eye clinic and you've recommended to have a treatment, please engage with us and talk to us. We're very happy to discuss why the treatment is necessary. And often it seems that the treatment is so invasive when you're not having many problems. But actually, what I've seen is the end result of that, where patients go blind in both eyes, and suddenly the situation is very, very dire. And sometimes there's not so much we can do at that stage. So this is my plea to take the diabetes seriously, because the eyes are so precious, and we don't want to firefight. We want to make sure the eyes stay healthy from the outset.